Go ahead, Pam, what's going on?
I kind of brought my August snapshot. I know we're in October and we'll be getting a snapshot for September ready. But the reason I did is, we reported 31 cases of COVID last in August. And we had 15 last week and 13 this week. And so we really are seeing that increase in COVID cases. We had that little surge in the summer, but we are seeing that we're spiking. And so far we don't have any influenza or RSV that's been reported, but it is that time of year. So just so everybody knows, the other thing that kind of goes with that is we no longer have free COVID testing kits, which we've provided for the last couple of years for the public, for county employees, those sorts of things. And we don't have that anymore. I know our department bought some to have on hand for us and for, if we've got a client or something that we really feel needs to be tested, but it might not be a bad idea to encourage people, the county's departments to maybe have a few on hand, because we no longer can supply those for them. They can be bought through the pharmacy, they can be bought online, and the government just opened up those 4 free kits again, so I'll get some information out about that. But that would, and I think some of those are short dated too. We've got kits that are expiring, but what we've noticed is that those expiration dates have been extended on those home test kits for about a year. So if it says expired, don't throw them until you check to see if they're still. You can Google the company Binex or IntelSwab or whatever and see if that expiration on that has been extended. So that's kind of something to think about. And then the other thing is that we are vaccinating now. So we are doing flu and COVID vaccines now. I sent out a department head note to everybody saying, let us know if you want us to come to your department. Please come and see us if you'd like. We are going to be flying the next couple of weeks trying to do our site visits. So we go into all the long-term care facilities to vaccinate, and we do a couple businesses. We do all the schools. So we've got those in the next couple of weeks. We really try to get vaccines in arms by the end of October. And of course, our long-term care is our priority. We still have 2 residential facilities in outbreak. So we aren't going to be able to go into those until we can get those outbreaks closed. And another thing with these COVID numbers is these numbers are skewed as far as what's really out in the public, because these are numbers of what's reported to us. And the only ones reporting to us are those who are required. Home test kits aren't required to be reported. So if you've visited a medical facility and been tested, or you live in a long-term care facility, those are being reported to us, but the home kits aren't. So what's circulating out in the community is, a little bit different view than this. And we know that there's more than what we have reported. So this year, flu vaccines are only a trivalent vaccine. We haven't seen the B strain of flu, the Yamagata B strain, since 2020. We think COVID killed it. We don't know what happened to it. It's not been detected anywhere in the world. So,
And it was the most popular strain, or?
It varies from year to year which strain. So we do the 2A strains, the 2B strains, and we're just not seeing that Yamagata B strain right now. So the vaccines are trivalent this year. For 65 and older, they're recommending either high dose or flu block. We carry flu block. And we really like that vaccine, and we didn't have it last year. And so we've got it again this year. So it's the time to do all that good stuff. Also with epidemiology, I've been kind of reporting on that active TB case that we're following. We have daily surveillance with their medications. They have had we thought they'd be done this first week in October with that regimen. However, they've had some other medical issues, so that might be extended. We're still kind of watching. They're actually out of state right now getting care for these complications that they're having. So they're not even in Montana right now, but that's been a really long process. Fortunately, this patient has been very compliant. Taken their meds regularly and, you know, has done all that's been asked, but that's been a concern too. We are continuing to do CPR trainings. We're using some of our FEP grant money to be able to provide those at no charge or low charge for the residents. We know that without an urgent care and without an ER, that emergency response is a challenge and one of the things we rely on heavily in this county. And so we feel that one of our ways to kind of strengthen access to care is to have bystanders be prepared to perform CPR. So we're doing CPR with first aid and Narcan training. In the schools, Molly's doing a class at Clancy, this week on Thursday. She's got a class for residents. So we're trying to do some resident training where people are showing interest. Let's see what else. My big passion project that's taken a lot of time has been the community health assessment and the improvement plan. And I just got a final document
Reprint?
for the CHIP, for the improvement plan. It was finished yesterday. That was the end of our contract with Yarrow. I have noticed a couple little things that need to be tweaked on it. So I'll give you one copy, but I'll send you an electronic version once we've read through it. Like I said, I got it yesterday and I haven't had a chance to really proof it. But it's a good plan, I think. We decided to do the two priority areas, health areas, which are mental and behavioral health, which doesn't surprise any of us, and which was on our plan last time. It's also on the state's health improvement plan, and that is just coming out for people to review. So I don't know if you're interested in looking at the SHIP, but I just got email on that yesterday too, so I could send it on. They're looking for people to kind of review it and provide comment on it. So we do a line there with them and also with Healthy People 2030s, which you'll see in this document that we do. We also developed a work plan to go with it. So this I'm not giving out to the public. This is kind of our plan that tells us how we're going to implement these strategies that have been determined and who's going to do it. Some of that lead person is in this, but not all of the plan is in here. So this plan is going to help us for the next 3 years to try to move some of these strategies forward. And some of these partners and lead people are people like the Mental Health Advisory Council, Superintendent of Schools. We will be partnering with law enforcement and legal. So what I'd like to request is a time for me to present both the Toronto CHIP in an afternoon commission meeting. I'd also like you to consider adopting it through resolution to give it some more credibility. So like I said, I'll leave this copy with you today and I'll send you electronic copies as soon as we've had a chance to make sure we're accepting it. I'm accepting it until I know it's done, right?
Somebody had read it last time and found an error.
Yes, we did in the CHA. So I'm
Is that in the CHA?
That was in the CHA.
Okay.
Yeah. So we ended up having to reprint
Reprint
the pages in that because we made an error. So I'm going to read this. I'm going to have my core committee. My core committee are Jim Murphy, Barb Ryder, LaDana, and Lindsay, both from planning, and Drew Dawson. So those are my core folks that have helped me through this and are going to help me with the implementation. I have applied for an implementation grant from the state to have some funding to do some of this work and the projects that we have in here. So I'm hopeful that that will come through. I also did hear from the state that I was accepted, our department was accepted to do their pathways project, which only a few health departments have been chosen to do that project. So they'll fund us $60,000 over 2 years, 30 each year to do that project. And it's not accreditation, but it's, I don't think small counties really can achieve that, but it's a pathway to accreditation. So we'll get a recognition if we choose to do that. I'm doing this more for succession planning than I am for recognition because I plan to retire in 5 years. So I want our department to be in good shape, and it helps us really look at our policies and protocols and those things that we're doing and make sure that they're in alignment with what we should be doing as a health department. And my staff will be very involved in both the implementation of this and with pathways, which helps them, as I do leave, to have that background knowledge for what we're doing and why we're doing it, and have resources to do what they need to do when I go and come back and vaccinate.
You're not going?
Yeah, January or June, I haven't decided yet, of 2030.
2030? Okay, that gives us a little time to talk to you. Little time to talk.
Molly's really working on me, but we'll see how it goes. So those are really some big things that we've got going on right now. I left my staff meeting to come here and we were playing a game that we played at Summer Institute. It's one the CDC produced. It's a BEP game, so public health emergency preparedness, and it helps you implement your pod plan, which is what we do for dispensing, like when we do a big immunization clinic, or if something happened and we needed to dispense, water or antibiotics or whatever the emergency was. So we're playing that game as a staff, but we'd like to play it with some of our stakeholders like DES, or you guys could come, some of our other providers, just so that people kind of understand why we do things the way we do. And with what's going on in the world right now, it's probably a good time to kind of push some emergency preparedness. We talked about that too. The other thing that we're going to pull people together to do is a measles tabletop, which also is a FEP deliverable and project. So we've seen measles kind of outcropping in certain areas due to low vaccination rates. And in fact, they've had measles in Idaho. So we keep waiting for it. Because measles is so highly contagious, we need to be able to respond quickly. So we're going to pull in our school nurses, administrators, health people, EMS people, and do a tabletop here in this building. See what the date is. And we'd welcome anybody who wants to come to It's October 10th, which is a Thursday at 1:30. And so we're going to do that to kind of plan and prepare in case we should end up with measles here.
Hopefully not.
I hope not too. We don't need that. Nobody needs that. But, like I said, we have seen some places that we've seen lower vaccination rates for our folks too than what we've had in the past. So just be preparing. I still believe in that. Public health saved your life today and you didn't know.
That's right. That's right.
We get ahead of it and then people don't know what happened. So, do you have any questions for me?
I'm curious if there's any inkling to when the CDC or the government's gonna kind of I guess, classify down COVID to where it's almost just like the flu or whatever. It seems like we're still testing and we're still getting all this information about it, but it's really, doesn't seem as critical as it was during our big outbreak.
Well, they really did in March last year. They put out respiratory virus guidance. So they included COVID, flu, and RSV in that. And that's really when we went to, stay home for 24 hours after, your symptoms have started to improve. We're still telling people, if you have vulnerable people who would get really sick from COVID, to use extra precautions, masking, staying home longer, staying away from them, distancing, those sorts of things. So I do have that respiratory guidance infographic that I made, and I sent it out to the department heads in that. And I think you guys are on that email too, but I can provide that for you. Where we're really struggling with CDC or the government entities, and it's really more CMS, it's Medicaid and Medicare, not bringing our standards back in alignment with where we're at with other respiratory viruses is in our long-term care. We're still counting one case as an outbreak, which is harsh because these people have been in jail for, I don't know how long now, seriously, and so, but until CMS changes their healthcare standards, there's nothing we can do about that. We have to follow their guidance or they don't get funded.
Gotcha.
I do have to say that we're a little more judicial when, like, we had a case in one of the long-term care facilities and it really affected their administrative people. It wasn't necessarily in their facility on their floor.
Yeah.
And we watched it for several days and we didn't end up calling it out because nobody else came down with it. So, we do know that those non-pharmaceutical interventions, we do work. We've seen it. And the more layers we put, the better off we are. So if we stay home, if we wash our hands, if we cover our coughs, if we get vaccinated, if we do all those things, we're adding layer upon layer.
Yeah.
So I don't know, Corey. We're all kind of rallying for CMS to.
Yeah, because it seems like we know enough about the disease now and that to me, it's very comparable to the flu, whether it be in a long care facility, whatever, you kind of do the same thing to prevent it here and there and everywhere, but we still seem to have this silo that we put it in and we have to treat it special and, it seems kind of ridiculous.
Well, I think we're slowly moving that way. It's been interesting. The PBS has a documentary right now called The Invisible Shield, and it's about public health. There's four installments of it, and Lewis and Clark and St. Pete's are showing it at the Myrna Loy. In fact, it's going to be on October 8th, on next Tuesday, there at 6:30. But you can watch it on PBS too if you have access to that. Mm-hmm. It's kind of interesting to be involved in the discussion. But once a month, they showed the first one last month, and they'll do one each month. And it was hard for me to watch that first one because they really went back to that first initial stages of the pandemic and what was happening. And honestly, we have post-traumatic stress from our department. Really, it really does. It produces anxiety. There's things I've forgotten. As I've cleaned out things as we've been doing all our moving, it's like,
yeah.
So, in fact, even playing this pod game today, it's appointed suspension for vaccination. So a lot of the examples we were pulling in while we were playing this game was from our COVID vaccination, our bigger events that we did in Montana City and here and the high school and how that all worked out. But anyway, it's hard. It's hard because there was a lot of fear and unknown, but you're right. We do know more, and I hope. Eventually, I think it will be more like the flu, where we have a little more lenience, and we're looking really at those vulnerable people, and we're looking at hospitalizations and deaths instead of everything. But it isn't quite there yet, and I don't know when. To answer your question, that was a long explanation.
No, I understand. Yeah. It's all has to come from the top down deal. So, how about I've heard of a new chemical out that people are getting in their drugs that's Narcan resistant, or it doesn't, Narcan has no effect on it. Have you heard of that?
Yeah,
I'm trying to think what the term was for that, but that's kind of interesting. That
I know.
it shows itself as opioids or whatever,
And
same
it's-
kind of thing.
and it's not-
Narcan
And
doesn't
it
work.
doesn't work on receptors,
Yeah.
yeah. I don't know, I mean, there's always something, we just think we're starting to get ahead of something and there's something
Something
more.
else, yeah.
Yeah.
That's
Yeah.
a scary one there.
Well, in Madison County, we do the OD map, and so we get alerts from around. Madison County had 4 overdose alerts last month,
Wow.
so it's close. Close in, we look at those main freeways, and then Madison gets a lot of travel, with the
And I think,
industries that they have,
part of
but
Big Sky is in Madison too, so that.
It
might be
is.
part of it too.
it is. Yeah, and they get, all that heavy tourist traffic.
Right. Good. Very good. You guys have anything for Pam?
Yeah, what's the latest on Butte Silver Bowl? Our
We
project?
met last week. And the latest was, well, I told you that, the grant is for 3 years. They neglected to add the contracted person that would do crisis intervention for the 4 small counties for year 2 and 3. So it's like 95, something like that, $1,000 that we'll get the first year. And we're still trying to figure out what that looks like for year
Say that
2
again.
and 3. So it'll be $95,000
Our share,
dedicated to us.
Jefferson County?
Well, dedicated to the 4,
Oh,
to the regional, to
Okay,
that regional, because that money's basically gonna go to pay that person.
right, okay.
I'm going to the crisis, that's the other thing I didn't tell you. I'm going to the crisis summit next week on Tuesday and Wednesday. I'm hoping to bring more information back from that. Crystal's gonna go too, and we've invited Dave Casola. I don't know whether Dave's gonna go or not. I'll have to reach out and find out. But hopefully we'll know a little more then. And then I meet the next week with Butte Silver Bowl again. So it's been a really frustrating process, Bob, because I said in the meeting last week, we haven't seen anything in writing.
I haven't any idea.
We don't know what we're getting. We don't know what we have to deliver. So one of the things I said last time is I said, with year 2 and 3, it might not be the end of the world if we don't get that funding. Maybe we can, know for sure what we can do and where we're at within that first year and look at how to take care of our own needs with whatever those are. Because my real goal that first year is to do that sim mapping to figure out what we can do for crisis in Jefferson County, where we're at. But I said, for year 2 and 3, my big concern is I don't want to sign a 3-year contract and I still have deliverables I have to fulfill in year 2 and 3, but I'm not getting any service for them. So I said, that's what I want to know is if we don't have any funding in year 2 and 3, what does that do for match? What does that do for deliverables? Because none of
Contract
us,
should be.
yeah,
Void then.
but I want it in writing. I want it in writing that we're not having any obligation if we're not getting any service from this grant. Because the overall is, and that's when I said, we haven't seen anything in writing. So that's what I'd
We
like
haven't
to
seen
see.
any case numbers. We haven't any idea how many crisis numbers we have in this county.
See, that's the other thing is we need data.
We need data, we need what they're asking for.
Right.
Give me your.
And that'll happen with the sim mapping. We'll get some of that data to come in.
But we should be able to get that before.
We should, and we signed that contract with
I don't even know if we
JG.
have a problem. I don't know if we have a problem in Jefferson.
I don't know either.
I have no idea.
Yeah. So that's a question I can ask next week. Who do I contact? How do we get that information? Because we know nothing. So that can be something I can work
So
on.
our share will be 22.5 or something roughly.
Yeah, I don't know.
And it doesn't have to be in cash, right? It can be.
No, it's all funny money, but, and we're doing it. I mean, it's not like it will be a problem finding that much money, but,
The e-care match, we probably can't be.
right. But we do need to figure out how we're documenting that and what they're requiring for documentation.
E-care,
You know, when we do that in-kind match, what is,
right?
you know, what are they gonna require for documentation on that?
Well, most of it will go to the coordinator, I suppose, but,
Yeah. So anyway,
and nothing new on e-care?
on what?
E-care,
No,
they've done the test, they've done the training, I think, you know, for law enforcement. So
yeah,
they should get up and running or anything.
yeah.
Speaking of crisis, you know, it's.
When
So,
you did your internal survey, the last time you spoke with us, remember, you were getting all the information and you were gonna disseminate it with the board or whomever that following week, and you were gonna meet with and decide where to go or what to do. In other words, that question that we all filled out. I can't remember what you call that questionnaire then. In other words, would you be part of this? Do you agree? What's your priorities? Do you remember that? And then you took all that and disseminated it, and you said you were gonna get a hold of whomever on your board, and you guys were gonna discuss it and see where things were gonna lead or where you were going to go. As for direction of travel, I guess. You understand what I'm saying? Probably not.
no,
And I might be confused here.
I'm not.
Like the form we all filled out, you know, that we went online, filled out the questionnaire, and then it went back to you.
I think that might be part of our.
And that's what I'm wondering if that's what that is.
Yeah,
That's what we.
That's what I was wondering.
that's a good direction to the health department.
Yes,
I think
That's what that
exactly
is.
That is, yeah.
That's,
Yeah, and so I can leave this with you. Like I said, I really don't want it out and about too much yet because I think I've noticed a couple things I'm gonna have them change.
The same photo, isn't it? No?
That's that's the improvement. It looks like it
Other
looks-
photo, it's not the same photo.
It's not, it's a different picture, but the graphic designer was the same person, so she built it. It looks very similar, but if you look at our last ones from 19 and 2020, the covers look very similar too. You have to kind of look at it. This one is smaller. It's like 20 pages instead of 60, so.
Wow.
I got Richland counties over there last week too.
Did you?
I'll share that with you and the strategic plan.
Well, you know, the Montana Healthcare Foundation has been putting them all online, but they're way behind on it. And I asked if they would put ours online. It's kind of nice to be looking at what other people are doing and what they're working on, but, and so anyway, feel free to look through, give me comments if you have them, but basically that's a lot of the plan of what we're gonna do for the next 3 years. And honestly, I tried to keep it kind of simple so that we can actually look at it and feel like, you know, we are moving the needle forward and
Maybe
making
achieve it.
progress. Yeah,
Maybe achieve.
we want to be achievers. Yeah, be achievable.
Pam?
You're welcome. Thank you.
And nothing on Lewis and Clark.
Nothing on what?
Lewis and Clark and their crisis.
You know, I
mean, my only commitment to them is we
in
would,
those meetings,
my only commitment to them, Pam, is we would use your facility if you don't. That's,
I can't even get them to tell me what their service area is. So, you know, they do things on this big grand scale on what, you know, and I get it. And it all looks great on paper, but I'm such a boots on the ground, let's get this thing done, that I don't get it. I don't, it's like, and Butte Silver Bowl is just like, yeah, you're part of us, we want to help you. I like them. Yeah.
yeah.
Well, so I don't know what they're doing, but I don't. Maybe I'll learn more at the crisis summit. All right, thank you all.
Yeah, thank you.
Have a great day.